Hey everyone, I'm Dr. Michael Breus, the sleep doctor, and I'm here today to answer some of your questions about sleep. Please remember this is not medical advice. I just don't have enough information on your personal case to be effective. You should always contact your physician with these questions as well. If you have a question that you'd like to see me answer, do me a favor, leave me a comment below or send me an email at asksleepdoctor.com. And if you like these videos, we have a lot more on YouTube channel, so do me a favor, hit that subscribe button. All right, question number 1. First up is Susan D, and she wants to know, I've gone to a sleep clinic, acupuncture, acupressure, sleep therapist, psychiatrist, therapist, got recommended mattress, pillow, sheets, room darkening blinds, earplugs, and the Calm app. Nothing has worked. Now what? So this isn't an atypical thing that I haven't heard come through my office before. There's a lot of different ways to take a look at something like this, but at the end of the day, if you honestly gave a shot to all of those different methods, maybe you don't have a sleep disorder. Maybe you have something going on from a mental health perspective. There are some people out there who think that they have a sleep disorder when in fact they don't. It's called sleep state misperception. There are some people who have such high anxiety that it affects their ability to fall asleep. Maybe you have a stressful situation at work, at home, something like that, but it feels like there's a mental health issue that could be going on. If you've tried all of these treatment modalities and absolutely nothing has worked, I would consider talking with your general practitioner about maybe seeing if there could be some mental health things that could be a little bit more helpful. Our next question is from Elisa M, and she writes, is there something that helps people with ADD, ADHD to get sleep? It seems like the typical things work in reverse for me. For example, caffeine can make me drowsy. Well, remember, one of the things you want to look at is how is your ADD or ADHD being treated? If it's being treated with stimulants and those stimulants have an effect of alerting you, then obviously you wouldn't want to have those too close to bedtime. Once again, you want to ask your doctor about the timing of administration for your ADD medication, because that can certainly be one of the things that can help with sleep. Another thing is to really think about eliminating caffeine. For a lot of my ADD patients, adding caffeine to the mix does things like making them sleepy during the daytime, which isn't particularly helpful in the evening times. All right, question number 3. Marshall B wants to know, sometimes when I have some carbs in the middle of the night, I can go back to sleep faster. Does blood sugar level or insulin resistance affect sleep? Yes, it does. As a matter of fact, I have several patients who wake up in the middle of the night and they say that if they eat a small amount of carbohydrates, it can be really helpful. What I have some of them do is keep maybe a pack or two of saltines or crackers by the bed with a little bit of water, and that usually seems to do the trick. But I'm starting to wonder about their blood sugar throughout the night. Remember, when people eat a large meal within an hour or so of going to bed, their blood sugar spikes up and stays high, and then in the middle of the night, it drops, and that can be a signal to your brain to wake up. So one of the things I tell people is you want to have enough time before your last meal in bed, which is usually about 3 to 4 hours if you can, in order to see if that works for you. And finally, question number 4 is from Motaz D, and they write, is there a way of reprogramming my bladder so that it will stop waking me up every 2 hours like a clock at night? Yes, there is. Number 1, look at your fluid intake. When is the last time that you're taking in fluids, and how much total fluid intake do you actually need? Speaking with your doctor and understanding what your personal fluid needs are, and then do yourself a favor, get them as early in the day as possible. Oftentimes, I'm asking my patients, with the permission of their doctor, to stop fluids about an hour before bed and making sure that they have to go to the bathroom. But another thing is, if you're a male person, you may require a prostate exam. So with prostate exams, that can also be something with a slightly enlarged prostate that can cause you to get up multiple times throughout the night as well. So looking at fluid intake and if you were born a male, looking at prostate are the 2 big things that I would take a look at. Thanks so much to all of you for your questions. These are great. I've got plenty more answers to your burning sleep questions, so do me a favor, check out another episode of Ask the Sleep Doctor right here. And remember, if you have a question you'd like to see answered, send me an email at asksleepdoctor.com or drop a comment below. This is Dr. Michael Breus, the Sleep Doctor, wishing you sweet dreams.